Good evening, guys. So, as you all know, we have our practice class today. So, we are going to begin with it with Paola. And so, remember, you will have 15 minutes each one of you, okay? And as we did last practice class, I'm going to call your names so you can join the meeting and have a little talk just between two persons, okay? Just one of you and me. So let's get started. Remember to join back at the end of the class for the daily survey or poll, okay?
Who's going after?
I'm calling by names. I don't know. Well, you all have 10 minutes to join the meeting. So in order of list, okay? I don't know who it will be because Bernardo is supposed to be the first one. However, he did not join yet. So depends on the person who's the first on the list. Hello, Paul, are you there?
Yeah, I'm here.
Hey, how are you doing? So let's make this real quick so you can be free to go.
Thank you
Okay.
very much.
Okay,
Thank
you're welcome. It's going to be really easy and quick. Okay. Could you, as you know, actually, this is an English class, so I'm not going to focus on the knowledge about medicine. I'm going to focus on your pronunciation. And if you give me a little pronunciation, well, if you give me a little knowledge about medicine, well, it's all welcome. Okay. So let's get started. Could you give me the definition of anemia?
you. It's um, it's I don't know it's a disease. Bueno, sorry, it's a condition in which you lack enough healthy red blood cells to carry adequate oxygen.
Oxygen.
Okay, oxygen to our body tissues.
Okay, yesterday we gave a little bit different definition. We do not take into account red blood cells actually because they can be, well, its values could be different and make us confused, get us confused. So what we actually care about when we talk about anemia is hemoglobin concentration. Okay, so taking into account that it is related to hemoglobin, could you give me a definition?
Uh, Hemoglobin, that's it's a conjunto. Let's say conjunto.
What do you want to say?
Es un conjunto de células en la sangre.
Uh, hem-
Se compone de un conjunto de células.
Hemoglobin is not made of cells. It's actually one molecule inside one cell.
Yeah.
Okay, so what would it be then?
is the iron containing oxygen transport metalloprotein in the red blood cells?
Okay, that is hemoglobin, right? That is the
Yeah.
molecule which is inside a red blood cell. So what would be anemia defined by the concentration of hemoglobin?
It's like a, a red blood cells count or the hemoglobin in less than normal, right? Is less hemoglobin.
Okay, I'm going to give you a little piece of an advice, okay? When we talk about blood, in this case, we have this prefix, which is HEM, right? Or HEMO, which is heme or hemo, related to hemoglobin, right? So
Hemoglobin.
when we talk about anything about, well, related to blood, we have this prefix. So it is pronounced hemo, okay? The H sounds like J in Spanish.
Yeah.
So it would be hemoglobin, okay?
Hemoglobin.
Okay, and as a definition of anemia, it is actually the decreased concentration of hemoglobin in the blood. Okay, it is not a lower count of red blood cells
Okay.
because the count of red blood cells can actually vary. Okay, for example, let me give you an example. A person who is dehydrated could be, well, his or her red blood cells count could be higher than normal.
Yeah.
So that is why we do not take into account the red blood cells count when we talk about anemia. We take into consideration hemoglobin, which is the molecule. Okay, so could you give me some symptoms and signs related to uh, any kind of anemia? Because you know that there are a lot of types of anemia. So give me the big picture, a general view of symptoms and signs.
I wrote a very symptoms and signs yesterday. I wrote general manifestations is a witness, right?
Okay.
Yeah. Skin manifestations is a paleness, palidez,
Okay.
and fragile nails.
Okay. What else?
Cardiovascular manifestations is shortness of breath. That
How?
is
Yes. How would you describe this symptom? What is it?
hypoxia.
Not really. A symptom is something that patient tells you, right? So
Okay.
what would the patient tell you for you to write down this symptom? What would the patient feel?
It's very hard. It's very hard. Can breathe. It's a let. I don't know how to say. Difficult. Inhalar y exhalar es hay una dificultad para inhalar y expirar.
Okay, keep it in English, please. So what would so the patient would tell you it is hard to breathe, but
Yeah.
would it be all the time, or would it be related to anything that the patient is doing?
Hypotension. Hypotension.
Uh, if it is if there's bleeding involved to the anemia, there would be hypertension. However, I'm asking you if this person, well, what's symptom are we talking about first? You were telling me?
Weakness?
Okay, weakness. Okay, weakness. How would you explain the weakness this patient has?
It's like when a person feel decisiveness, like decisiveness, right? Decisiveness is decisiveness.
Uh,
María, ¿se dice así?
Dizziness. Dizziness.
Dizziness.
Okay.
It's like when a person feel dizziness, her arms or their arms, legs, and head, and head. Sorry, and head.
Okay.
It's like tired. Uh, I don't really explain, but I feel that this concept is very close to weakness, right? It's like
Yeah.
tired when person feel tired, right?
Okay, it could be. It would also be explained as a lack of force, of strength. Do you know what lack is? Lack.
No.
Okay, lack is in Spanish would be que falta algo, right? Deficiencia de algo. Strength, lack of strength would be falta de fuerzas.
Mhm.
That would explain it better, right? So weakness would be a lack of strength for the daily activities. However, this symptom is present all the time, or would it be like more perceivable by the patient in a certain situation?
Depend of this situation, yes. Not
Yes.
all the time.
Okay, when would it be? What do you think your patient would tell you that
Uh,
that feels weak, right?
yeah. Um, I I think that the person feel a weakness, a increase of weakness. It's like when person the person don't eat the don't eat very good, right? I don't know, when the person it's it very bad. It's too can be genetic.
Um, Not really. Well, this person, the patient, does not feel weakness all the time. As you said before, you were right. However, when does the patient feel weakness is when this person increases his metabolism, increases like when you exercise. Well, when this patient would exercise, is increasing his or her
Yeah,
metabolism. So since there is little oxygen to be carried to the peripheral tissues, that is when this person feels weakness, especially during an increase of the metabolism as when we're talking about exercise, okay?
I read that vitamin B12,
Okay,
the decreased vitamin B12.
okay. So talking about that, do you know what pernicious anemia is?
Sorry, what?
Do you, well, you just mentioned B12 vitamin, right?
Yes.
So
Okay, okay. Perchenous anemia.
pernicious anemia, yes. Do you know what that is?
It could happen in people who are unable to absorb vitamin B12 from their intestines due to a
Uh-huh.
number of reasons.
Okay, so in this case, what is related to the deficiency of absorbing this vitamin. This is an
Uh,
immune process. Do you
yeah.
know what this is about?
Long-term alcoholics. Alcoholics. Sorry, alcoholics.
Uh,
It's alcoholics, not alcoholics.
Actually, well, it could be for
Uh,
it could be, yes, because well, this. Do you know what cells? Do you know what the intrinsic factor is?
um, I'm not very. No, it's for eight. No, eight is the hemophilia. I don't know. I don't know.
Okay, okay. Well, there are several types of cells inside our stomachs, right? One of them that we already talked about is the parietal cell, which
Ah,
produces acid, right? And
yeah.
that one also produces one protein, which is the intrinsic factor, which joins the B12 vitamin inside the the small intestine and binds with it and travels to the last part of the small intestine. What this both molecules are absorbed. I mean, the intrinsic factor and the B12 vitamin. So when there's an immune process in which the parietal cell is destroyed or the intrinsic factor is destroyed, the B12 vitamin cannot be absorbed. And then we have this kind of anemia, which is pernicious anemia, right?
I get it.
Okay, so what kind of red blood cells would you see in a patient who has pernicious anemia in a peripheral blood smear?
Mm, the manifestations or what?
Nope. Yesterday I talked about peripheral blood smear. Do you know
Ah, yeah,
what?
yeah.
Could
Uh,
okay? Could you tell me what kind of cells would you see in pernicious anemia in a peripheral blood smear?
microcyte.
Great. Yes, you are right. Yes, you would see a microcyte, a macrocyte. Actually, it's bigger, right?
Yeah, macrocyte.
Yes. Awesome. Okay, you have. Well, we have accomplished the 15 minutes. You did great. Um, well, next week we're going to talk about some other diseases, okay? Okay, so you're free to go now, but remember you have to join back when
Yeah,
I
yeah, yeah.
send a message, okay? So have a good night.
You too.
Okay, bye.
Bye.
Danitza, are you there?
Yes.
Hey, Danitza, how are you doing?
Um, I'm doing great. Thank you.
Okay, so as we said before, we're just going to talk about anemia, okay? However, I know that you are great students at the university, so I'm going deeper inside your
Oh,
knowledge, okay? So,
no.
yes, you are. You all answer. So let's get started. Could you give me the definition of anemia?
Um, well, the anemia, um, well, is a decrease in the number of the red blood cells, and well, actually, the concentration of the hemoglobin,
Great. Awesome. Yes, you were
um,
that last
is
part, you did it great with the pronunciation. It's hemoglobin, right? Okay.
hemoglobin. We um, it's important to have to no. It's important to know that anemia is not like a pathology or like a diagnosis. It's a manifestation, like a sign or something like that, um, of um, like como decir, I don't know how to say it in English, but I mean like it when I don't know. I'm sorry.
No, don't worry. It's okay. You hesitate, but you are doing fine. You okay? I think you're where you're going. It's like it's not a disease, and you are right. It's like a manifestation of a different, an actual disease, right?
Yes, yes,
Uh,
oh, exactly.
Yes, you are right. Yes, that is actually what it is. Yes. So, could you tell me some? Well, yesterday we talked about anemic syndrome, right? Could you tell me some manifestations like symptoms and signs related to anemia?
Oh, the most common manifestation in anemia are fatigue, weakness, um, pa- uh, pallor. I don't know how like palidez,
Paleness,
um,
okay,
paleness. Also, dizziness,
great.
dizziness. um, uh, that's the most common manifestation of
Okay,
anemia. Also, we can see in this patient, like you said it yesterday, um, tinnitus,
great, yes.
headache.
Awesome.
Well,
Okay,
it's
yes, you gave
yes.
me a lot of them. Yeah. So, could you tell me any other symptom or sign related to a specific type of anemia? Let's talk about the most common ones, which would be iron deficiency anemia. In Spanish would be anemia ferropénica, right? So, could you tell me specific manifestations about iron deficiency anemia?
Um, I yesterday we talked about um, this I I remember like the concept, but I don't remember the name of
Okay.
the
So you could describe it for me, right?
well, it was like the patients has this uh, they have this need of chewing like ice or something like that.
Yes.
I
Great.
um
Yes, that is called pagophagia. Pagophagia.
uh,
Okay.
I got yes. Also that there was like I don't know if like it's from the iron deficiency deficient. How can I say how
The specific type of
iron?
anemia is iron, which is hierro, right? Iron deficiency anemia. which would be anemia por deficiencia de hierro, right? So
yes,
it would be iron deficiency anemia. What else will we find in a patient who has this?
we find koilonychia, was something like that.
Yes, great. And you said it great, yes. And what it
like
is?
the spoon nails, where the nails are has the like the nail seems like spoons.
Yes,
No.
yes. They have the shape, right? The shape is forma, right?
Yes, the shape.
Yes, of a spoon, right? Yes. So yesterday we also talked about a peripheral blood smear. Do you remember what it was? This technique, this laboratory test?
The frotis pericono.
Yes.
We
yes.
can see like in this test by the microscope.
Microscope. Yes.
The form of the cells, the
Yes.
size of them.
And what would we find in iron deficiency anemia?
I don't remember.
Okay. You will. Well, we have like regular red blood cells, right? Which are roundy and they are red, right? And when yes, okay, I'm listening.
No, I'm not. I'm not really sure. You can go on.
No,
Sorry.
you were saying, come on.
No, I wasn't saying anything.
Okay, so we have regular red blood cells, which are roundy, right? And they are red. They look red under the microscope, right? So when a person, your patient has this type of anemia, what kind of cells would we find? I mean, they are smaller, right? And they are pale because they do not have, well, they have a little hemoglobin and some little oxygen. So it
like I'm sorry. Like we can describe this type of cells, or well, like I remember in Spanish, anemia microcítica hipocrómica.
great. So it is just very similar. The names are quite similar to Spanish. So what would we call them?
Microcytic and hypochromic
Great.
red blood cells.
Yes, that's what we would find. Yes. So what about, do you remember what RDW was?
I'm sorry, can you repeat?
Yes, sure. Yesterday we also talked about some, well, it's like an abbreviation of something, okay? It has 3 letters, which are R, D, and W. Do you remember what it was and what this was used for?
Oh yes, yeah. The red cell distribution width.
White. Okay.
White.
Yes. And what it is? Do you remember what it was?
That I don't remember. I just remember the name and
okay.
how it was something about to with era como que I'm sorry the It was like the size, but it was
Yes.
some like, pero era, I'm sorry, I don't know how to say it. Como la anchura or something
Okay.
like that.
Okay. We're trying to keep it in English. Okay. So,
Yes,
what?
sorry.
No, don't worry. Okay. So this it was like there's a normal range in a percent. There's a normal percentage in which normal red blood cells can vary their sizes. Okay, so it goes from 11 to 15. So those red blood cells that are normal can vary their sizes in uh, from 11 to 15%. If you have lower than 11 or higher than 15, it is pathological. In this case, when we're talking about iron deficiency anemia, how would you find your RDW?
Um, 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 can you repeat again the question?
Yeah, sure,
I
no
get
problem.
lost.
Okay, so what is the main, well, we have some materials, right, from which you have your red blood cells formed in your bone marrow, right? And one of them is iron, right? So when the bone marrow is releasing your red blood cells, they can normally vary, right? It's well, their size, and uh, the normal range is from 11 to 15, right? So in iron deficiency anemia, how would you expect to find a patient's RDW? Is it normal? Is it increased?
Well,
Is it lower?
lower or oh no, maybe. Okay, we have like a not. Mm, can it would be high or
Yes, it would be higher than 15 because the problem is in your bone marrow, right? Because the body does not have enough iron. So some cells, some red blood cells, go out to the peripheral blood normal, and some of them are smaller than normal. So it varies in size. They vary in size. So when you measure your RDW, it is increased because they vary or the size variation is bigger than normal. They some of them go out normal and some of them go out smaller. So the variation in size is higher. Do you get it?
yes, I get it.
Okay,
Thank you.
you're going to read it that for tomorrow. Well, for Monday. Okay.
Yes, yes. Okay.
Okay. So we have 30 seconds left. Do you have any doubts? We only talked about yesterday's class. So
Yes. I couldn't like watch the video on YouTube. I don't know if well, I don't know what happened, but
okay.
I don't know if you uploaded. You have
Okay.
to.
I send. Well, I usually record it and I send it to our coordinator, and she actually uploads the videos. So I'm going to
Yes.
ask her. Okay.
Yes. We because it's not
On the YouTube channel.
on the channel. Yes, it's not.
Okay, I'm going to
Not
ask
on.
Allison. Okay.
Oh, okay, doctor. Thank you. And
Okay.
please, if you can share some of this content of
Like the
some.
like the presentation, or you want
or the slides
any?
or something else if you can to read,
Oh, okay,
because
like
like
books or
yes, please, if you have them
sure.
on PDF.
Yeah, I do have some books in Spanish and some books in English and some books in Portuguese. So I will send you, or if you, well, write what you need, and I will look for some books to send them. Okay.
Okay, doctor,
Okay.
please.
Okay. Don't worry. So I'll see you at the end of the class. Okay.
Okay, doctor, thank you.
Okay. No, you're welcome. Okay. Bye.
Bye.
Hello, Brisa. Are you there?
Yes, I am. Good night.
Hey, how are you doing? Good night. So we're going to start with the practice class. You have 15 minutes from now on, okay? So could you give me a definition of anemia? Of course,
Anemia?
yes. Well, this well, this is an English class, so we are going to focus on your pronunciation and your vocabulary and all that kind of stuff, okay? However, if you give me some deep knowledge about medical stuff, it will be welcome, okay? So, could you give me a definition of anemia?
Yes. Well, anemia is a condition in which, like, your body or your red blood cells are not able to carry the oxygen to the body's tissues, I think.
To peripheral tissues, right? Yes. And what if we talk about hemoglobin? What would you tell me uh, anemia is?
Uh, about hemoglobin, I didn't understood.
Okay. How would you relate the levels of hemoglobin to anemia?
Well, when someone has anemia, usually the hemoglobin is lower than the normal.
Yes. Okay. Okay. So a definition of anemia is actually a lower concentration of hemoglobin according to some variables, right? Do you remember what those variables are?
You mean the types of anemia?
Nope. I mean, for example, uh, a person who is, well, a man, let's say a man, has a higher concentration of anemia, right, of hemoglobin, right, than women.
Mm-hmm.
So those variables are, so let's say a person has anemia when his or her levels of hemoglobin are lower than normal for his or her sex, age, and altitude in which this person lives. It is not
Mm-hmm.
like a general rule for everybody, right?
Yes.
So, could you tell me some? Yesterday we talked about some symptoms and signs that are general in all types of anemia. Could you tell me some of them?
Oh, symptoms and signs. It could be breathless. I think it says. Oh, shortness of breath.
Shortness of breath.
Yeah, shortness of breath. And
Because breathe, you write it the same way, but it's the verb.
mhm,
Okay, breathe,
okay.
to breathe is the verb respirar. Shortness of breath. Breath means aliento. Okay, so shortness of breath would be the symptom. Okay, what else?
The yellowish skin.
In all patients, or in what kind of anemia specifically?
The deficiency of iron.
No, really. It is actually, well, in iron deficiency anemia, some people say that patients have a terrace skin color, like has well, the skin of those patients have a similar color to earth, to um,
Orange or brown.
yeah, it's like brown, like brown and pale, something like that. Okay. So do you know what the term was for what you were saying, like the yellowish skin?
Um, uh, Pale, I think.
Pale is like whiter than usual, right? But
Mhm.
yellowish in Spanish would be ictericia, icterico, right? So
Mhm.
what kind of anemia would be related to that symptom? Well, to that sign actually.
Mm, Maybe the vitamin deficiency, or I don't know.
Oh, nope. It would be related to hemolytic anemia, okay, in which the red blood cells are destroyed inside the body. So it releases hemoglobin, and hemoglobin, as you know, is a precursor of bilirubin, right? So the skin and the scleras and all that kind of tissue goes yellow. So it would be related to hemolytic anemia, okay?
Okay.
Okay, so what else would we find in a patient with anemia? Any other symptoms or
Mm,
signs? General ones. The yesterday we talked about anemic syndrome. Do you remember what was related to it?
the fatigue.
Okay, great. What else?
Um, mm, I don't know if it's right, but weakness.
Yes, great. Awesome. And why would this person feel weakness? Do you know?
Um, no.
Okay. I mean, we all kind of remember like weakness, and that would be it, right? But we have to know the reason why this person feels weak. A person with anemia feels weak because since there is little oxygen that reaches the peripheral organs, like all organs, right? So the I mean, there is as the kidneys sense that lower iron, sorry, that lower oxygen concentration. So it makes like the peripheral vessels constrict. Okay, and this blood is redirected from the peripheral to the internal organs, to more vital organs. So when a person feels weak is because his or her muscles are not receiving enough oxygen.
Okay.
Okay, that is
You
why.
you say a word. I don't remember. Streak. What does it mean?
Uh, Sorry, I didn't get it.
I don't remember if it was a streak or a streak.
Oh, well, I don't remember what kind of word it was. Could you spell it maybe so I can get it?
No, I don't know. I just listen it right now.
I said it now.
Yes.
Oh, I don't remember. Was more or less what I was talking about.
Um. Uh. What you are saying right now?
Well, I don't remember that specific word. Well, I'm going to remember it later, okay? And then I'll tell you what it means. There are several types of anemia, right? Do you know what pernicious anemia is?
Mm, the pernicious anemia is the vitamin deficiency anemia, right?
Yes. Which vitamin is it related to?
The vitamin B12.
Great. And could you tell me what this specific type of anemia is all about?
Mm, it can interfere with the production of the red blood cells.
Great. But give me a little more info, a little more information. What is it related to? I mean, why is it produced? How it is produced?
Um, I think there are fewer and healthy red blood cells in the body that the normal in this condition is because of the lack of vitamins.
And
And it's more common in a pregnant woman.
actually, in pregnant women, there is let's say physiological anemia because they tend to, due to some hormonal conditions that they might have, I mean, pregnant women, they tend to regain liquid. I mean, they do not get rid of liquid very easily. So this increases plasma, and it's like it's the opposite of concentrated, so it dilutes, right? So it is actually not anemia. It is like physiological anemia. However, it is not related to it. I mean, why does pernicious anemia is produced? You said vitamin deficiency, right? But why is it lower than usual? This vitamin.
Um, because some people don't eat enough of these vitamins.
Okay, that would be one. Okay, lack of eating that kind of vitamin, right? And what else? There's an immune process right there.
Maybe the person body cannot properly process or absorb that vitamin.
Yes, yes, that is related to it. Absorption. This vitamin cannot be absorbed, but why?
I don't know why, but I've heard that
Okay.
some uh, celiaticos
Celiac
have
patient with celiac disease, it would be related, yes. Okay, you give me one reason. And do you know what intrinsic factor is?
no.
Okay, intrinsic factor is like is a molecule which is produced by. Do you remember we already talked about parietal cells in our stomachs?
Yes, yes, I do.
It produces acid, right?
Mm-hmm.
It also produces this molecule, which is intrinsic factor. Okay, so this molecule, when we eat meat, which is the most common way of having this vitamin, right? This B12. So when we eat this meat, for example, this intrinsic factor binds or joins this B12, and they travel together to the last part of the small intestine, and this complex of two molecules, which are the B12 and the intrinsic factor, are absorbed together. Okay, do you get it?
Mm-hmm.
So
Mm-hmm.
when there's an immune process in which parietal cells are destroyed, there is no intrinsic factor. So the B12 cannot be absorbed. That is pernicious anemia, actually. And there is another reason. So that one reason would be that parietal cells are destroyed and they do not, well, since they are destroyed, they do not produce intrinsic factor. There's another explanation, which is that some antibodies join the intrinsic factor and do not let the intrinsic factor join the B12. So it also does not get absorbed.
Okay.
That is pernicious anemia. Okay, so we talked about peripheral blood smear yesterday. Do you remember what it was?
Peripheral what?
Blood smear.
No, I don't remember what it was.
Okay, if I spell it out, maybe you could remember. It's SMEAR.
Mm,
Smear.
no.
Okay, I'm going to say it in Spanish for you to understand. Okay, it's frotis de sangre periférica. Okay,
Mm-hmm.
that is peripheral blood smear. So in a peripheral blood smear in pernicious anemia, what would you find?
Mm, I don't know.
Okay, you're going to read that for uh, you're going to read that for Monday. Okay,
Okay.
you get actually, since there is well, you have this deficiency of B12, right, in this kind of anemia. So this B12 is not only related to red blood cells, it is also related to any kind of cells production, any kind. So it actually, the bone marrow does not have enough B12 to produce red blood cells. So they go out to the peripheral blood bigger than normal. And then we have macrocytes that we already talked about. Macrocytes are those that are, well, they are bigger than 100 femtoliters big. Okay, so you read it for tomorrow. Well, not for tomorrow, for Monday, and you will tell me what it is. Okay.
Okay.
Okay, so you, well, we accomplished our 15 minutes, and remember to join at the end of the class for the poll, okay, or survey.
You're gonna write on the chat too, right?
Yes, I'm going to tell you when to join.
Okay. Thank you.
Okay, I'll see you later. Thank you. Bye.
Bye.
Diana, are you there? Hello? Hey, Diana, how are you doing?
Ay,
Hey,
¿me escucha o...?
yes, I can
Porque
hear
a
you.
veces no me funciona el micrófono.
Okay, I hear you now. Okay,
Okay.
okay, so yeah, we have our 15 minutes from now on, okay? So
Okay.
could you tell me a definition of anemia?
Is a condition in which you don't have enough healthy red blood cells to give oxygen to your body.
Okay, great. And how would you relate that kind of knowledge to the concentration of hemoglobin?
um, I really don't know.
Okay, yesterday we said that anemia is actually a decreased concentration of hemoglobin in the blood. Okay, because you said that it was a decreased number of count of red blood cells, right? We do not take into account the count of red blood cells actually, because they can vary and make us confused. Okay, so when we talk about anemia, it is related to hemoglobin levels.
Okay.
Okay, so yesterday we also talked about some symptoms and signs related to anemia. Could you tell me some of them?
Um, Weakness,
Okay,
headache.
it would be headache.
Oh,
Headache.
headache.
Okay, great.
Okay.
What else?
Yellowish skin.
Yellowish. Yeah, maybe. Yeah. Yeah. Okay. What else will we find in anemia?
Irregular heartbeat.
Okay. Great. Okay. What else?
Uh, I don't know how to pronounce it.
Uh,
Fatiga.
okay. Fatigue. Okay. So, what else?
Uh, you feel your hands and feet cold.
Okay. Maybe. Okay. Um,
Um,
okay. You can go on.
your chest hurts.
Maybe when it is an acute and severe anemia, it could be. It could be like when you have an infarction, okay? And that would be the same reason, because in when we have this disease, which is atherosclerosis, right? The patient's arteries are like blocked, right? In this case, it would be like the blood does not have enough oxygen that is carried by the hemoglobin, so it would be the same principle. In acute and severe anemia cases, it would be, okay? So what else?
um, I don't remember more.
Sorry?
I don't remember more symptoms.
Okay, it is great. Yeah, it is good. Okay, you remembered a lot of them. Could you explain the reason of weakness in anemia, of course? Why does the patient feel weak?
Um, cause but um, cause I haven't seen this in the university. So yeah, my
Okay,
mom explained this to me, but I don't remember.
okay, it's okay, don't worry. So let me explain, okay? You're going to
Okay,
see it,
please.
okay, you're going to see it at university. However, well, you know, there's a decreased concentration of hemoglobin, right? And hemoglobin carries blood to all the tissues, right? They deliver oxygen. So when there is a lower concentration of hemoglobin, all the organs do not receive enough oxygen. So as a reflect, peripheral blood vessels vasos sanguíneos periféricos, right? They contract to distribute this blood that goes to the skin and that kind of superficial organs. The blood vessels constrict, okay, and that blood that is supposed to go to those organs actually go to the most vital organs, which are, for example, kidneys, brain, and all heart, and all those organs that are more vital. Okay, so when these arteries, these blood vessels contract, they do not leave space for blood to reach peripheral organs such as muscles and skin. Okay, so when this person has anemia, its blood does not reach muscles, for example, and that is well, that blood is actually going to most important and vital organs. So weakness is related to a decreased consumption of oxygen by muscles. Okay, did you get it?
Yeah, thank you.
Okay, you're welcome. So yesterday we also talked about some specific symptoms and signs that would be related to specific types of anemia. Do you remember any?
Um, my internet is bad. Can you repeat it again?
Yeah, sure. Yesterday we talked about specific symptoms and signs related to specific types of anemia. Because what you tell me is in general all types of anemia, right? Weakness and headache. Patients who have anemia have that kind of symptoms, but any kind of anemia. In specific types of anemia, for example, iron deficiency anemia, what would the patient have as a symptom?
All right. For a symptom for a specific type of anemia.
Yes, in this case, let's talk about the most common one, which would be iron deficiency anemia. What symptoms would this person have if this person has this diagnosis? Besides the all the general ones that you told me.
Um, sorry.
Diana, are you there?
Yeah, but my aunt is talking.
Okay, do you remember any symptom related to iron deficiency anemia? Diana, are you there? Come on, don't be shy. Come on. I know
No,
that you know.
I'm sorry.
Don't worry,
Um,
come on.
um, dark green,
Sorry?
dark green.
Urine. Not really. Do you
I
remember yesterday we talked about koilonychia? Do you remember what koilonychia was?
um like you said spoon, uñas
Yes, great.
con las uñas cuchara creo.
Yes, great. They're like nails that have the shape of a spoon, right? That is, koilonychia is related to iron deficiency anemia, and this is a sign of iron deficiency anemia, and a specific sign. Do you know any other besides koilonychia? Yesterday we talked about some specific type of pica.
I don't remember the name, pero era de las alturas.
Keep it in English. Come on, we're in an English class. Yesterday we talked about on a specific type of pica. Do you know what pica is? Pica, pica.
No.
Okay, pica is actually. Do you remember what craving means? Craving.
Yeah.
Okay, when a person has some specific type of pica, okay, has the cravings for something, to eat something, okay. For example, in iron deficiency anemia, there would be pagophagia, which is a specific type of pica, in which this person has the cravings for ice, so wants to eat ice. Kind of weird, right?
Kinda.
I mean, do you want to eat ice all the time? Not really, right? So this person, well, a person who has iron deficiency anemia could have pagophagia. Okay, that is the cravings for ice.
Okay.
Do you remember what peripheral blood smear was?
Can you repeat it, please?
Yeah, sure. Do you remember what peripheral blood smear was? Let me spell it for you. SMEAR. Do you remember what it was?
Mm, um, the one that it goes to your heart, arteries, veins.
Do you remember what smear was? I'm going to say it in Spanish for you to remember it, okay? It is frotis de sangre periférica. I'm sure you read about it.
Um, Not really.
Really? Okay. Were you in physiology class when you talked about blood in your university?
I haven't seen the class.
Sorry?
Um, this was my first year, so I'm gonna
Okay.
see it in the next year.
Next year, yeah. Next year you have this subject, right? Which is
Yeah.
physiology. Okay, when you see it, when you have this classes about physiology, I'm sure you're going to take blood samples with your classmates, and then if you want to see your classmates blood under the microscope, you're going to perform this test, which is the peripheral blood smear, which in Spanish is frotis de sangre periférica, to see it, the blood under the microscope. Okay. um if you do you have any doubts about pronunciation, especially?
No.
Okay, we reached our 15 minutes corresponding to you. And remember to join at the end of the class for the poll, okay?
Okay.
I'm going,
Is
yeah.
there any problem if I stay here in the meeting, or I
Uh,
have to leave?
Do you want to listen to other people talking to me?
Oh no, in the other room.
Oh, sure. You can. I mean, all of them should stay. I'm just going to close this group chat, and we're all going to the big group. Okay.
Okay.
Okay. So remember to join, and I'll see you later.
Okay.
Okay. Bye.
Bye. Have
Thank
a
you.
good
Bye.
night.
Don't. You're not leaving yet.
No,
Come
no,
on.
no.
Okay. I mean, it's like a farewell. So I'll see you later. Okay.
Okay.
Okay. Danita Zambrana, are you here? Hello. Danisa, are you here?
Yes, good night.
Good night. How are you doing?
So,
Oh, sorry to hear that. Are you sick or something?
yeah.
Oh, sorry to hear that. So, are you able to do the practice part or do you want to rest?
It's okay for me.
Okay. So, we have 15 minutes starting from now. Could you give me a clear concept about anemia?
Okay. Um, Anemia is disease by deficit of red blood cells to carry adequate oxygen.
Okay, and how would you apply that knowledge to the concentration of hemoglobin?
In woman or man?
It does not matter which sex this person has. In actually, anemia is a lower concentration of hemoglobin in general. Okay, we do not take into account the number of red blood cells because it could make us confused. For example, as I told you yesterday, when a person is dehydrated, the concentration of the number of red blood cells could be higher than normal, but it does not mean that the hemoglobin levels are affected. So when we're talking about anemia, we are actually talking about hemoglobin concentrations. Okay.
Okay.
So yesterday we were also talking about some symptoms and signs related to anemia. Could you tell me some of them?
Okay. In general, manifestation is weakness.
Sorry,
Um,
what it was?
weakness. Weakness.
Weakness.
Weakness.
Weakness.
Yes,
Okay.
weakness. Um, Skin manifestations is paleness, facial nails,
Okay. What
um,
else?
a cardiovascular manifestation is hypotension and shortness of breath.
Okay, let me clarify this. It is actually shortness of breath, okay? Because breathe is the verb, okay? Breathe is the verb like respirar, breathe. And
Mm,
breath, you write breath and breathe the same way. But when you say breath, it means in Spanish aliento, okay? And breathe is the verb respirar. Okay. In this case, it would be shortness of breath.
Breath.
Yes.
Breath and breathe is respirar.
Yes, great.
Okay.
So what else would we find in a patient with anemia?
The patient,
Yes, so the symptoms and signs. What else would this patient have?
I don't know.
Okay, let's remember a patient who has anemia has something called anemic syndrome. We also talked about it yesterday. It is related to, for example, what you said, weakness. Okay, it is related to shortness of breath that you also said. It is correct. It is also related to, do you remember this symptom related to ears?
Headache,
Okay, there's headache and there's another symptom related to some sound. You hear all the time some like whistling, a continuous whistling. That, do you know the name of that symptom? Yesterday we talked about it.
can you repeat, please?
Oh, the question?
Yeah,
Okay. Okay. Yesterday we talked about some symptoms and signs related to anemic syndrome, right? And we talked about one of them, which is related to listening some whistle, some continuous whistling in your ears. Do you
oh,
remember the name?
tinnitus,
Tinnitus.
tinnitus.
Yeah, that is the one. Okay. So we have shortness of breath. You tell me shortness of breath, weakness, tinnitus, what else? Headache, right? What else?
Um, oh, I don't know. The sinus, the sinus, the
Sorry?
sinus, the sinus.
Uh, I don't know what you're referring to. Could you tell me in Spanish?
Um, can you hear me?
Yes, I hear you. I
Oh,
don't really remember that symptom that you said. I don't
the
get it.
sinus, the sinus is mareo,
Dizziness.
illness.
Dizziness. Okay. Well, that is well, you feel dizziness, right? And
Illness.
when you want to say that you feel dizziness, you do not say I feel dizziness. You say I feel dizzy. Okay, me siento mareado. I feel dizzy. Okay,
Okay.
so yes, great. Dizziness, headache, shortness of breath, tinnitus, weakness. Yes, you told me a lot of them. So we already, well, you told me the first one you said was weakness, right? Which is debilidad, right? Weakness. Could you explain me? Uh, could you explain the reason why there is weakness in anemia?
Mm, is for deficit of hemoglobin. If the hemoglobin is very low.
Okay. Okay. So what happens in our muscles, for example?
Sorry, my connection is very bad. I don't hear.
Okay. Okay, don't worry. So the main reason why there is weakness in anemia is that when there's a lower concentration of hemoglobin and, for instance, a lower concentration of oxygen, right? So when our muscles are, well, they, as every cell in our body, our muscles need oxygen. So when there is anemia, the peripheral vessels, blood vessels, they contract to redistribute the blood to more vital organs, such as kidneys, heart, and brain. So skin and muscles do not get enough oxygen. So that's why you feel weak, because muscles do not get enough oxygen, okay? So yesterday we were talking about red, um, yesterday we were talking about peripheral blood smear. Do you remember what it was?
In Spanish is el perfil de sangre. Es el porcentaje de sangre periférica. Sí, peripheral blood smear. Yeah.
Smear is, it's not percentage. It's smear is frotis de sangre periférica,
Sí.
right? That is peripheral blood smear. So when we're talking about anemias, the most common one, do you know what the most common type of anemia is?
Is a deficit of iron.
Okay, iron.
Iron.
Yes, so it is called iron deficiency anemia. In Spanish would be anemia por deficiencia de hierro or anemia ferropénica, right?
Yeah.
So in a peripheral blood smear, what would you find if your patient would have iron deficiency anemia? What would be the findings in a peripheral blood smear?
No, I don't know.
Yesterday, I showed you one slide in which there were normal red blood cells, which are roundy and they are red, right?
Yeah.
In iron deficiency anemia, those red blood cells do not have uh, enough hemoglobin, so they are not that red. They are pale, right?
Yeah.
And what could you tell me about? Well, I already told you something about the color. Could you tell me anything about the size of those cells?
The size.
Yes.
Mm. Oh, sorry, I don't remember.
Don't remember?
Um,
Okay, so when there is iron deficiency anemia, what we see in a peripheral blood smear is that they are small red blood cells and pale. They are small and pale. So when you see those cells under the microscope, they are smaller than usual and they are paler than usual. Okay, because the normal ones are roundy and they are red. In iron deficiency anemia, they are pale and smaller. Okay.
okay.
What term would you use to describe those cells? We also talked about that yesterday.
The cells or
Yes.
peripheral blood smear
Yeah.
is the morphology is normal red blood cells and microcytes,
Yes, microcyte and
macrocyte,
okay. In this case, when we talk about iron deficiency anemia, which one of them would be? Would they be normal? They would be bigger. They would be smaller.
in this in iron deficiency anemia.
Yes.
Is microcyte.
Yes, microcytes. And what about the color?
Um, hypochromic, microcyte hypochromic.
Yes, great. Hypochromic and microcytic, right?
Microcytic.
And when we were talking about, do you remember what RDW stands for?
W.
RDW. Yesterday, we also talked about it.
Yeah. Is 15%?
Yes, you're going the right way. It actually it means red. I mean, there's three letters, right? R, which stands for, well, it comes from red, okay? D, that comes from distribution, and W comes from white, okay? In Spanish would be amplitud de distribución eritrocitaria, okay? What does it represent? It represents the percentage of size variation of a lot of red blood cells, and they normally vary between 11 and 15%, right? What you just told me. In iron deficiency anemia, how would the RDW be? How would it be?
Is 15% or major.
It's higher than 15%, okay? Because the sizes of those red blood cells vary more than usual, okay? So when you have hypochromic and microcytic anemia, you go to your RDW, and if it is higher than 15%, you have your diagnosis, which is iron deficiency anemia.
Okay, it's higher.
Yes. For example, in some other case in which you have microcytic and hypochromic cells, you go to your RDW and it is normal. So which means between 11 and 15, right, is normal. So when the RDW is normal, you also have your diagnosis, which is thalassemia. I don't know if you ever read about that. Thalassemia in Spanish, right?
Yes.
That is a different type of disease. So if you have microcytic hypochromic and your RDW is normal between 11 and 15, you have your diagnosis, which is thalassemia. And when you have microcytic and hypochromic cells and your RDW is higher than 15, your diagnosis is iron deficiency anemia. Okay?
Okay.
Okay, great. So we already reached our 15 minutes. So remember to join at the end of the class, please, for the poll or survey. Okay.
Okay.
I'm going to write in our WhatsApp group to join. Okay.
Okay.
Okay. Thank you. I'll see
Thank
you
you.
later.
See you later.
Okay. Bye. Marcela, how are you doing?
I'm fine. And you, how are you?
I'm fine, thanks. Thanks for asking. So, Marcela, yesterday we were talking about anemias, right? It is the most, well, it's the easiest topic in hematology, right? So that's why I chose this topic. So could you tell me, or could you give me a definition of anemia related to the concentration of hemoglobin?
Well, I can say it's like a low number of red blood cells. Sorry.
Okay. And what about the concentration of hemoglobin?
Um, well, it also reports like a low account of hemoglobin.
Yes, actually, if you read any kind of book of hematology, the concept that you're going to get is actually related to hemoglobin and not to the count of red blood cells, okay? Because we already said that red blood cells count can vary. However, hemoglobin concentration does not vary. So when we take into account the count of red blood cells, it could confuse us. Okay, so the anemia is actually a decreased concentration of hemoglobin. So yesterday we were talking about some symptoms and signs related to anemia. Could you tell me some of them?
Maybe one of the first it will be that the person will look like tired because of this person doesn't have enough hemoglobin on their cells, for example.
Yes, okay. So the person would feel weak, right?
Yes.
Okay, what else?
The skin will turn like yellow or pale.
Okay, okay, great. What else would this person have?
And also maybe a headache.
Okay, headache, great. Anything else?
Um, well, this person also can have like a disease or like feeling like this person is like how can pacing out like when someone suddenly stand up and it feels like everything is turning dark. The
Like
most common.
blurry vision, something like that. Visión
Uh,
borrosa, something like that.
well, I don't know if you have heard about this as a joke, but when someone has anemia, like when this person stand up pretty fast, it feels like
Ah,
he.
yes. Hipotensión ortostática, right? That one.
Yeah.
Orthostatic hypertension. Okay, that could be, yes. Yeah, when a person stands up really quick, right? And
Mhm.
feels like blacking out.
Yeah.
Okay, could be. Yes. Anything else you would like to add about symptoms and signs?
Mm, I don't know if shortness of breath could be any symptom.
Okay, yes. Actually, it is breath, not breathe, because breathe, okay, breathe is the verb respirar, breathe, and breath is aliento. So shortness of breath would mean falta de aliento, sensación de falta de aire. So in this case would be shortness of breath.
Breath, shortness of breath. All right.
Okay. Okay, yeah, that is correct. Anything else?
I don't know if what else can I say? I think just that.
Okay, do you remember what tinnitus was?
What?
Tinnitus. Tinnitus.
Tinnitus. Um, Actually, no.
Okay, this is actually a symptom in which this person is listening to some ringing or whistling in her head. That is tinnitus. Okay,
Okay.
that is called tinnitus. That could be related to anemia and some other diseases, but it could be related to anemia. Okay, tinnitus. Okay, you told me you didn't tell me headaches, for example. This person might have headaches.
I
Uh,
say
okay, headaches.
yes,
Uh,
yes.
anything else about anemic syndrome?
Um, no, I think I say all that I could remember.
Okay, that is great. Do you remember any symptom or sign related to a specific type of anemia?
Um, Maybe I told you that when someone has like anemia, the skin turns like yellow. Maybe could be one symptom. Oh,
That
well,
is actually a sign, right?
that's okay. I'm saying sorry.
Do you know what that sign is in English? Like in Spanish, it is ictericia, right? Piel y mucosas ictéricas, right? So in English, do you know how to say ictericia in English?
Mm, mm, mm. Okay, I forgot about it.
Okay, it is jaundice.
Jaundice.
Yes, I'm going to spell it for you, okay? For you to remember. It's JAUNDICE, jaundice. That is ictericia, okay, in English. So, what kind of anemia would jaundice be related to?
Um, well, um, mm, to any, well, I I really don't know to which kind it will be related actually.
Okay, some books say that in any type of anemia, the skin turns a little bit yellowish, right?
Mhm.
However, what I have read about this is that it is actually, well, the skin turns actually or takes a terrace color, like the earth, like some brownish, orangish color. However, when a patient presents jaundice, it's actually related to hemolytic anemia. Okay, and why would it be related to hemolytic anemia? Do you know? It
It's
is
be-
logic.
it's because well I think it will be because we don't have like enough oxygen in our body.
Okay, actually, it will. A person would have jaundice because do you know what hemolytic means? Hemo means like blood, right? And lytic comes from lysis. And what does lysis mean? Lysis, lysis.
Like the death of well, ISIS is the death or any cell.
Like destruction, right?
Uh-huh.
So in hemolytic anemia, the red blood cells get destroyed. Okay, so inside of a red blood cell, there is hemoglobin, right?
Yes.
So the hemoglobin is released to the bloodstream. It is not longer inside a red blood cell, it is in the bloodstream. So where does bilirubin come from? It comes from hemoglobin. So this person starts creating bilirubin from hemoglobin. So this person's bilirubin levels start increasing. That is why jaundice appears. Okay, so a person who has anemia and there is jaundice, you have to think about hemolytic anemia.
Okay, so it's when the hemoglobin get out of the red cell. So it's like this. Here comes the bilirubin, as you say, and
Yeah.
I started thinking about him, um, anemia hemolytics.
Yes, it is the destruction of red blood cells. So the hemoglobin gets out of the red blood cell, and you know the metabolism of bilirubin, right? It starts from hemoglobin. So when as the hemoglobin is in the bloodstream, starts the metabolism of bilirubin, in which the hemoglobin is transformed into bilirubin. So do you know what indirect bilirubin is?
Could you repeat, please?
Do you know what indirect bilirubin is? The difference between direct and indirect bilirubin?
Indirect, it will be like we're creating, but not because we want, because it's because if something is going wrong, no?
Actually, there are two types of bilirubin, okay? The indirect or non-conjugated bilirubin and the direct or conjugated bilirubin. And the indirect is actually the one that is free, okay? And the direct bilirubin is the one that has joined a glucuronic acid in our liver. So when the bilirubin that is in the bloodstream in peripheral blood goes through the liver, it conjugates with this acid, which is glucuronic acid, and turns into direct bilirubin, which is secreted by the gallbladder into our digestive system. So in this case, there would be an increase of indirect bilirubin, okay, related to the higher levels of bilirubin, anemia. We have to think paleness and of course jaundice. We would have to think about hemolytic anemia, as I was telling you. Okay.
Okay.
Okay, so we are done with our 15 minutes. And remember to join at the end of the class, please, for the poll or survey. Okay, I'm telling you when to join. Okay.
Okay.
Okay, thank you. See you later.
See you.
Diana, are you there? Valeria, are you there? Hey, Valeria, how are you doing?
Hi, good night. Fine, kind of. I got back. I got the third doses yesterday.
You get what?
The third dose for the vaccine.
Oh,
I got
from
vaccinated.
the vaccine.
Yeah.
Some people get kind of ill with that third dose. Did you get kind of sick?
Yes. I'm having a headache and muscle pain, and a little bit of nausea.
Yeah, it's kind of awful. Happily, I
Mm,
didn't get it, but I know some people who did. I mean, for example, person who I live with, my wife, was like sick for a whole day.
mhm.
Yeah, it's terrible. What kind of vaccine are you using in your country?
Well, we have Pfizer, Moderna, Sinovac, and AstraZeneca.
For
But
the third dose?
it depends in which one was your first one, in which vaccine. I
Okay.
mean, for example, Sinovac is Pfizer. Pfizer is Pfizer, Moderna is Pfizer, AstraZeneca, I think is Moderna, and
Wow. Which one
uh-huh.
did you get?
Pfizer.
Okay, I hope you get better. Did you take
Thank
any
you.
medication?
Yeah, sure. As right now, ibuprofen.
Okay, so I hope you get better.
Thank you.
So let's get started.
Okay.
Okay, so yesterday we were talking about anemia, right? Could
Yes.
you give me a definition about anemia related to hemoglobin concentrations?
Related to like okay. I remember that I told you that anemia is when you don't have enough red blood cells to carry oxygen, right?
Yes. Okay, correct. However, when you read any book related to hematology as a specialty, you're going to realize that it is actually not related to the red blood cells count. It is more related to the concentration of hemoglobin. Because if we take into account the count of red blood cells,
Mm-hmm.
it could make us confused because in some other diseases, uh, it could uh, go higher or lower. However, the hemoglobin concentrations is not affected. Okay, so when we talk about anemia, you have to relate it to hemoglobin concentrations, not to red blood cells count. Okay?
Okay.
Okay, great. So yesterday we were also talking about some symptoms and signs related to anemia, right? Could
Mm-hmm.
you tell me some of them?
Weakness,
Great.
um, headache. I think I
Yeah. Headache,
pale skin. Pale skin or dry skin, and jaundice.
jaundice. Okay. Uh, okay, jaundice, it could be, but related to a specific type of anemia.
Anemia. True. I told you.
Which specific type of anemia would be related to jaundice?
A.
Sorry?
A.
Uh, Let me repeat the question. You said jaundice, right?
Yes.
However, jaundice is not related to all types of anemia. It is kind of specific to a certain type of anemia. What type of anemia would this be related to jaundice?
Iron deficiency?
Nope.
No. Or what? Or type A? Or
You
no?
mean you mean the
Or
groups, the blood
how?
groups? Okay, it
How?
is related to it. It is actually to hemolytic anemia.
Hemolytic. Okay.
You know what hemolytic means, right?
No.
No? Okay. Hemo comes from your hemo group, right? It is part of the hemoglobin, so it means blood, right? And lytic comes from lysis, which is Lysis. Do you know what lysis means?
Lysis uh, no.
Okay, in Spanish would be hemolytica.
Okay, okay.
So it would be lysis, right? So lysis or lysis in English would means actually destruction. Okay, so when we're talking about hemolytic anemia, we're talking about an
Sure.
anemia that is related to destruction of red blood cells.
Okay.
Okay, so what happens next? I mean, inside our red blood cells, we have hemoglobin, right?
Mm-hmm.
And when they get destroyed due to the term hemolytic, for some reason, red blood cells are destroyed. And since they are destroyed, it releases hemoglobin. And do you know the metabolism of bilirubin? I'm sure you read about it, right? Where does bilirubin come from?
Um, I don't. No, I don't know.
Okay, if when you get to this part of the physiology class, you will
Mhm.
realize that
True that.
bilirubin comes actually from hemoglobin. Okay,
Ah, okay.
hemoglobin turns into bilirubin, and in a specific type of bilirubin, which is indirect bilirubin. The difference between direct and indirect bilirubin is that indirect bilirubin is all alone. I mean, it does not join any protein or anything like that. And direct bilirubin is when the indirect bilirubin reaches the liver and is conjugated, so it binds to another molecule, which is glucuronic acid. And that bilirubin that is joined, that binds to this glucuronic acid, is called direct bilirubin. So when these red blood cells are destroyed, releases hemoglobin, and the bilirubin metabolism initiates, and as a result, we have indirect bilirubin. So indirect bilirubin levels increase, and that is why hemolytic anemia is related to jaundice, because bilirubin is yellow, right? So that
Yes.
is why. That is why.
Mm.
Okay.
Okay, I didn't know.
Okay, now you know.
Thanks.
Okay, great. So that is why jaundice is related to hemolytic anemia, not all types of anemia. Okay.
Mhm.
Paleness, I mean, when you have paleness, it's like you have a whiter color than usual, right?
Mhm.
And how could you explain a person who has anemia and is pale? Why is this person paler than usual?
Why is pale
Yes,
when a
when
person
has anemia. Yes.
maybe because bueno, paleness may be caused by when by a reduced blood flow and oxygen.
Yes, great.
Uh,
So when there is anemia, right, the
mm,
peripheral vessels contract and redirect all that blood that is supposed to go to muscles and skin. They
mhm,
redirect this because they contract into more vital organs and more important organs like heart and kidneys and brain. So so they can take away they can consume the oxygen, the lower oxygen. So paleness is explained by a reduced blood flow, as you said.
okay.
Correct. So yesterday we were also talking about some types of, well, we were talking about some specific types of anemia. And we also talked about iron deficiency anemia, right?
Mhm,
And we also talked about a specific test, a laboratory test, which is peripheral blood smear. Do you know what it is? We talked about it yesterday.
Very, what was it called?
Sorry?
What was that test called?
Okay, it's peripheral, peripheral blood
Uh-huh.
smear, SMEAR.
I remember we talked about it. Is in which no, they count different blood cells, I think.
Okay.
Or I don't remember quite well.
Okay, it is when we have a peripheral blood sample
Uh-huh.
and we put it to see under the microscope, right?
Microscope, yes.
Yes, that is what it is. So, in iron deficiency anemia, what kind of red blood cells would you expect to find in a peripheral blood smear?
What kind of blood of
Red blood
cells?
cells. Yes, red blood cells, of course, because we are talking about anemia, right?
I don't know.
Okay.
Como plaquetas? No.
Um,
Oh, I
no.
don't understand.
Okay. When well, now we're talking about anemia, right? In which, well, hemoglobin is decreased, is lower than usual, right? In anemia. So they are inside red blood cells, right?
Yes.
And when we see these cells under the microscope, these cells are not normal because, I mean, the patient has anemia, right? So these cells are smaller than usual and they are also pale. The cells. What is that called? Do you remember? Yesterday we
No.
also talked about it. Microcytic.
No, I don't remember.
M- micro comes from small,
Mi-
right?
uh,
And cytic from cell. So they are small cells. They are smaller cells than usual. And hypochromic, chromos means color, right? So hypo, little, means little. So they have these red blood cells are pale because they have lower, less color, and they are smaller than usual. So when we see those cells under the microscope, we call them, we can call this anemia as microcytic and hypochromic anemia.
Hypo and micro.
Yes. Okay.
Okay.
Okay, so Valeria, we are done with our 15 minutes. So I'm going to, well, we have to get rid of this poll thing, this survey. And you, after that, you're free to go. I'm going to tell them to
Join.
join, okay?
Okay.
So guys, we're done for today. I think there were only 7 of you today, right? I don't know if anyone noticed how many of you were today in class. So we wait for anyone else to join back or just go on. Does anybody remember how many of you were here at the beginning of the class?
I think just 7.
Okay, so I think you're all right. You're all here. So we're going to start, please. As usual, okay, guys, as you know, let me know when you're done, please. And right after that, you are free to go and enjoy your weekend. And I'll see you on Monday.
I'm done.
Okay, thank you. I think there's one more person who did not. Okay.
I'm done too.
Okay, guys, so I think all of you just did it fine. You did it quite fine today. And I'll see you on Monday. Enjoy your weekend.
Okay, see you soon.
Okay, see you on Monday. Bye, guys. Have a nice weekend.